Bioavailability describes the concentration of drug in systemic blood in relation to the amount of drug given. So this is an important concept to understand, because how the drug is administered affects bioavailability. Intravenous medications go directly into the bloodstream. So remember, bioavailability is the amount of drug in the bloodstream compared to the amount of drug given. So if we give the drug directly to the bloodstream, by definition, bioavailability is 100%. So it's important to remember for board questions that all IV medications have 100% bioavailability by definition. PO is a Latin abbreviation for by mouth. Something very important to remember about oral medications is when they go into our gastrointestinal tract and they are absorbed into the blood, that blood goes directly to the liver first. And so everything you eat, that blood goes to the liver first for examination and processing. Which leads us to the first pass effect. All drugs absorbed by the gastrointestinal tract will enter the portal blood supply. The portal blood supply comes from the gastrointestinal tract and leads to the liver. So when we take a medication by mouth, when we take food by mouth, everything enters the portal blood supply and goes directly to the liver for processing. So the liver metabolizes many drugs before they're able to enter the systemic blood supply. So the bioavailability of a PO medication is rarely 100%. The bioavailability of most oral medications range from 10% to 50%. So if you take a 100 milligram dose of a beta blocker and its bioavailability is only 10%, that means the liver breaks down 90% of that drug before it enters systemic blood supply. Which leads us to a very important concept in the safety of administration of medications. Many medications that you will be giving can be given either orally, PO, or intravenously, IV. So do you think the IV dose is always going to be equal to the PO dose? No, absolutely not. Take the case of an oral beta blocker. If the oral dose of a beta blocker is 100 milligrams and 90% of that is broken down with the first pass effect, that means only 10 milligrams enters systemic blood supply. So the equivalent IV dose for that 100 milligram oral dose, the equivalent IV dose would be 10 milligrams. So be very careful. With some medications, yes, the PO dose and the IV dose will be similar. But most of the medications that you deal with, the IV dose will not be equal to the PO dose. Never assume that the IV dose of a drug is the same as the PO dose.